let me just select it properly. Just a minute. Okay, so let me just show you. This is a hemoglobin and oxygen O2 association dissociation curve. Now see our hemoglobin. Hemoglobin is really very smart. See, this is the RBC. Inside an RBC, there will be many hemoglobin. What is the function of hemoglobin? You all know that function of hemoglobin is to carry oxygen. Okay, it is that the function is to carry oxygen and even carbon dioxide. Right. So what is happening? It is functioning in a two mechanism, two different way. Okay, so let me just say that partial, have you heard of partial pressure of oxygen? That is the PaO2, partial pressure of oxygen, PaO2. It is the oxygen, okay, partial pressure of oxygen, PaO2. The partial pressure of oxygen inside the artery. Okay, so whenever in atmosphere, it may be 100. Okay, in normal it will be alveolar pressure will be 100. Then I breathe in. Okay, I breathe in. Inside my lungs here, the capillary that are having fresh blood will be having the partial pressure of oxygen around 100. Okay, so see, you can remember like this, that there is blood surrounding this RBC. There is blood surrounding this RBC, and in this blood, the partial pressure of oxygen is 100. Partial pressure of oxygen is 100. So what will happen? All the oxygen will go and bind into this. All the oxygen will go and bind to what? To hemoglobin. They will go and bind to the hemoglobin. This is good. That at 100 partial pressure, all oxygen should go and bind with that particular hemoglobin. Now you imagine, the nature is so beautiful. You just imagine that now you are having a tough time. Maybe you are in Leh Ladakh, or you are in Western Ghat, or you are in Himalayas. And what is happening? The thing that is happening, that overall oxygen in the atmosphere has dropped down. So previously this was 100. Now I may say, let me just use the eraser. Now I will say that the volume, the partial pressure is around 80 only. I'll just say 70 only. Okay, let me just say it is just 70. What will you think? That previously on hemoglobin, this is the hemoglobin, my hemoglobin molecule. If previously on hemoglobin, with the help, this partial pressure of oxygen is helping the oxygen, that certain amount of pressure is required for oxygen to go and fit inside this hemoglobin pockets. These are the pockets. So at 100, all these pockets were getting filled up. So do you think that at 70 also they will be filled up? Some may say, no, sir, at 100 you said that all are filled up. And now at 70, these pockets will be a little bit empty. That oxygen cannot be carried because it is very low. But no, my dear, this is the beautiful nature of our system, that even if you see over here, even if the partial pressure from 100 it goes to 70, look over here, what is the percentage of HB saturation? See, I'm talking about percentage of HB saturation. Everyone knows that hemoglobin have such 4 pockets. Okay, how many pockets? Hemoglobin have 1, 2, 3 and 4. Like this, hemoglobin have 4 pockets for oxygen. In each of this pocket, one oxygen molecule will be sitting like this. Okay, one will be sitting like this. Achha, normally all these pockets are not full. Only on the lungs where they want oxygen, there it is filled. In the periphery, if you see, it will be partially empty. Okay, so in hemoglobin, let's just concentrate over here. In hemoglobin, that is at lung I am talking. This whole story I am talking at the lung capillary. Okay, so in this capillary, I told you that these are the empty pockets. And to fill this empty pocket, let me just clear this empty pockets. Okay, I cleared all. To fill this this empty pocket, I need partial pressure of oxygen. That is the PaO2, partial pressure of O2. At how much O2 I need? Usually I told you I will need around 100. But even at 70, they will be completely filled. That will be around 95%, you can say. So see over here, 100% was at 100. Now it is around, see how much it is. It has not gone drastically. It is still more than 90. If you can see, it is still more than here. If I say it is 90, it is still more than 90. So even if I reduce the partial pressure from 100 to 70, even 60, that oxygen saturation will not drastically decrease. It will just mildly, gradually, it will decrease. So that is why this curve is around flat. This is like flat like this. Okay, so it is good, isn't it? It is good. But what is going to happen now? Okay, now I got all the, this is good. Why? Because even at Leh Ladakh, I can completely take whatever oxygen available in the environment. Now this hemoglobin will go to tissue. The lung side is clear now. Now it is going where? It is going to tissue. Inside the tissue. Now we did what? Now we say that partial pressure of oxygen at tissue level. How much is it? At tissue level, it is around 40. Okay, at tissue level, it is around 40. So remember, my hemoglobin, it is little naughty. What is it doing? At 40 level, out of 4 pocket, he got all this 4 pocket filled. Na? Out of 4 pocket, he will leave the 3 pockets. The 3 pockets will be, that oxygen will be given to the tissue. 1, 2, and this third one will be given to the tissue, but one pocket is still full with oxygen. You see, only 75 and only 25% is saturated, 75% is empty. Means what? Means what? That out of those 4 pockets, only 3 pockets got empty. Okay, so percentage of HB saturation at 40, you check it at 40, at 40. Oh, sorry, my bad. 3 pockets were very sorry. Hemoglobin is very cunning. I'm sorry. Again, I'll say again. Okay, very sorry. Okay, see what I told you. Here, 4 pockets are full in the lung capillary. In the lung, 4 pockets are full. Now, when it came to tissue, what is going to happen? Tissue, 40 hemoglobin, partial pressure is 40. What is going to do? This oxygen, 1 pocket is filled, 2 is filled, 3 is filled, and 4 is filled. Now this hemoglobin is so cunning. Even if tissue are requiring oxygen, tissue are in desperate need of oxygen, they are just providing 1 pocket out of it. Very selfish, na? Very selfish. They are keeping 75% of oxygen with them, and they will just give 1 molecule. This 1 molecule will be given to the tissue. And then, is it fine with you? Tissue said, yeah, it's fine. You are giving me, it's fine. I'm enjoying. Okay. Now what? Tissue was fine at certain point, that even if partial pressure is 40, if you give me this 1 molecule also, I'm happy. So at partial pressure of 40, see the cunningness of hemoglobin is very cunning. Okay, let's see over here at partial pressure of 40, the hemoglobin is still how much saturated? Around 75% saturation. Okay, means 3 molecules of hemoglobin, oxygen are still with hemoglobin. Now what is going to happen? Now our muscle or our tissue are in desperate need. What is going to happen? They are doing exercise. You are maybe playing cricket or hockey, or you are doing some eating, running, whatever. Okay, now our tissue needs lot of what? Lot of what? We need oxygen. So what is going to happen? Now when you do, everybody knows that, see, this graph is like this. It is very bad, na? This graph is like this. What does it graph say? The higher the slope is there, higher the slope is there, oxygen, hemoglobin is keeping that oxygen with them. Now what is going to happen? See, for example, in the tissue there is too much of oxygen demand. Okay, too much of oxygen demand. That can happen when there is, you are running or something. What is going to happen? Too much of carbon dioxide will be produced. Yes. Temperature will be increased. Yes. There will be acidic, because more H plus will be produced. So more acidic environment will be there. So what is going to happen? Now this curve will be shifted towards right. You see, shifted towards right. By shifting right, what did I do? Just remember, by shifting right, what did I do? That previously at 40%, 40 mm of Hg partial pressure of oxygen, around 75% of hemoglobin was saturated. Means out of the 4 pockets, 3 pockets were full of oxygen. He was very cunning. He was not giving to tissue. But now, when I secreted, when being a tissue, I am in desperate need of oxygen. I secreted what? I secreted CO2, I secreted H plus, my working, so temperature is raised. Now what is going to happen? This shift is there. The curve is shifting to the right. Means what? Now you see this blue color, now you follow this blue color graph. In this blue color graph, what it is showing? At the 40 level, at the 40%, same partial pressure of oxygen. Now what is going to happen? See, around 60% hemoglobin is saturated. Means what? That furthermore 15% of oxygen is delivered to tissue. You're getting it? You're getting my point? What happened is, tissue secreted some substance. Because of that, this affinity of what? Affinity of oxygen towards that hemoglobin pocket decreased suddenly. You see that? See, there are 3, I mean one more pocket, like 4. So previously it was so much affinity, so much, one over here, one over here, one over here, one over here, like this it was there, at 100%. Then what happened? Then it came to 40, so 1 was delivered. Cunning hemoglobin, he just delivered 1 is gone, only 3 are left. But now tissue desperately requires oxygen. Okay, so what did tissue do? It secreted H plus, it secreted, temperature was raised, CO2 was raised, and because of that, this affinity of this oxygen molecule to this hemoglobin pocket got decreased, and the curve is shifted to the right. Means what? With the same pressure, now this pocket will also be empty. Which one? This, let me just show you. This pocket will be also empty. This pocket has gone empty. Understanding? Means what? Where it goes? It goes to the tissue. This oxygen is given to the tissue. So now tissue has 1 or 2, that is around 40% of oxygen, more oxygen they got. Understanding my point? So factors that are shifting the curve to right, which can be there, which are they? They are anything which requires more and more oxygen, exercise and all. Okay, so there will be reduced oxygen affinity to the taut state, that is the hemoglobin. Isn't it correct? And it will be caused by what? Low pH. Let me just put it like this: low pH. Oh, sorry, I should not use this. Low pH, and one more, increased CO2, high temperature, high 2,3 BPG, and low affinity HB variants. Okay, so these all are the questions. These are shifting the curve to the right. Exactly opposite will be shifting of curve to the left. That is high pH, low temperature, low 2,3 BPG, fetal hemoglobin. Why fetal hemoglobin? Because fetal hemoglobin has highest affinity for oxygen. Okay. And carboxyhemoglobin, same happens in carboxyhemoglobin. So anything that has high O2 affinity will be shifting the curve to left. Anything which cause low affinity to hemoglobin will shift the curve to the right.